So this is just a little demonstration of single interrupted suture technique. Key points to take away from this are ideal position to hold the needle. So we look at perpendicular or 45 degrees, but we're not looking straight on the needle holder. We're using some Castrovaggios. Also taking that 90-degree bite in the tissues, not trying to grab all the tissues all the way through, so not biting both sides of the flap, but coming through, taking a hold of the suture again so you've got control, and then coming through so your second bite again is at 90 degrees, and that helps the knot lock down. Then checking that your knot isn't tangled, so that you've got a nice flat knot against the tissues. So when you check as you've gone through and you've done your 2 turns towards, have a little look and just make sure that that looks nice and flat, so it's going to tie flat down onto the tissues, otherwise it's going to come undone. And then just pulling that down, locking it down, and that's your first knot locked. That's your surgeon's lock, and then one back and then one towards, and then cutting the sutures down. Straightforward single interrupted suture. So for this demonstration we're going to be using a 6-0 non-resorable suture. So when we're holding the needle, we want to avoid the tip. We don't want to blunt that. We don't want to be holding the needle at the end here. We want to be about 2/3 down the needle, and we want this perpendicular to our needle holders. We can also have it at 45 degrees, but what we don't want is the needle coming out in the same plane as the needle holders, because that's going to not allow us control. And then when we're entering the tissues, what we want is about a 3mm bite, and we want to be entering at about 90 degrees. So if we use our tweezers just to pull some tension onto the tissues, lift the flap towards ourselves, and then we've got that 90-degree entrance with about a 3mm bite. And what we'll see is we come through the tissues, we're also coming through at 90 degrees. We can then use our other instrument to take a hold of the needle, and again away from the tip, and just bring it through the tissues. We can then, just like a knife and fork, take a hold of the needle again, and then lifting the other side of the flap, we want to enter again at 90 degrees, about a 3mm bite, and in the same plane as our entrance. So we're following the tissues through, and then again, just like a knife and fork, we can just bring this through. So we've got similar distances on both sides of the flap. Now what you don't want to do is be lifting this needle and chasing your staff's eye. So what you do with this is you can just, once you're through, drop this down, leave it on the surgical drape, and then just bring the suture through with your fingertips, leaving that needle nice and safe. It'll be absolutely fine. And then you want a decent amount on the tail end. You don't want to pull this too short. So a nice long thread. If you're doing this intraorally, you want this outside of the patient's mouth, ideally, so you can grab a hold of that. Now we're going to be tying the knot, so we take a decent amount of gain out of the thread. We do 2 loops towards ourselves, take a hold of the loose end, and then we're going to gently pull, and we're going to have a little look at this knot. And what we want is we want this to lie flat against the tissues. Now you can see there that that is nice and flat. As it was originally coming through, it was twisted, and that's going to gain more bacteria. It's going to make the knot difficult to lock down. So we want that nice and smooth, just like shoelaces are when they sit up against the shoe. So we want that appearance when we're locking it down. And then what we're going to do with our needle holders here is we're going to take these down to the edge where we first entered, and then we're going to pull flat against the tissues with our non-dominant hand. And then once we're starting to lock down, we can just pull away and then that is going to allow us to lock the suture in, and that's our locking knot. We then go one away, lock down again, keeping things nice and flat again against the tissues, one more towards, and then lock down again. If you're using resorbable, you may wish to do another throw, and we can see we've approximated the tissues there, and then we want to just cut the thread down. We leave about 3 or 4 millimeters of thread, and then there's our suture. For single interrupted, you just keep repeating the process, and you have these at a distance, so these tissues are all nicely approximated. You don't want any gaping wound.